Okay, so we are joined today by Dr. Agnes and Dr. David Roze, the husband and wife power couple when it comes to oral health and dentistry. I'm so excited to have you both on here because Dr. Agnes Roze is a specialist in pediatrics, and Dr. David Roze works with adults. And so I thought, since majority of our members are parents and a lot of the questions that are coming in seem to be directed to the family and children, I wanted to have you both on. So thank you so much for taking your time to be here with us. I am going to turn it over to you. I'm not sure if I mentioned the date. Today is October 20th for those who want to know when this was recorded. And so I will turn it over to you, and please feel free to continue introducing yourselves and get started.
Thank you so much, Bernadette. So first, we are very happy to be able to share our knowledge in biological dentistry, because this is for us, like I would say, a passion, and we keep discussing it every day at home between us. So it's nice to be able to, that you give us the opportunity to share this. So as you said, I'm a pediatric dentist, and David is an oral surgeon. So he's going to talk more about all the surgery part, the ozone, the cavitation, the ceramic implants, and I will probably talk a little bit more about the cavities and the remineralization and the mouth briefing. So we wanted to start a little bit by explaining what is a biological dentist and what is our purpose as a biological dentist. So normally, as you may know, as doctor, we have a principle which is primum non nocere, which means do not harm. This is the oath that we do as a doctor. And so that's why our mission for us at first is to be a non-toxic clinic, which means metal-free, mercury-free, fluoride-free, BPA-free, chemical-free office. So we're really trying to, for our patients, to just introduce and place into their mouth the most biocompatible material, which means it's not the most common use, it's not the most affordable, or it's not the most distributed, but really the one that's going to mimic as a maximum the natural body, the teeth and health, and it's going to integrate really well in our oral microbiome. And at the same time, the difference is mainly that we're going to look at your teeth, of course, your mouth, but we're going to look much further and try to look at your entire immune system and your whole body. So how do they interact, and how your lifestyle, your diet, your physical activity, your well-being, and your mental health is going to have an impact, or the mouth's going to have an impact on there. So really the interaction in between the mouth and the body. And starting from there, we can do a planification, which means, okay, we're going to study everything and then put a treatment plan that's going to integrate all of this.
That means as well, for example, if we take, for example, the patient that wants to have an extraction, a wisdom teeth extraction, that we won't do it immediately. We will probably first take the time to boost the immune system of the patient before we do the extraction.
So what is a functional and integrative approach? So we're going to try to understand what's the root cause of the mouth issue, or what's the root cause of something that we're going to see in the mouth, but it's actually going to start in the body. So it's all interconnected. And that's why we're going to try to develop and discuss a bit more for now, how the chronic disease can have an impact on the mouth, and how the mouth can have an impact on the chronic disease. So let's have a look at that picture, the tree of biological dentistry. So if you look at the first upper front of the slide, it's what normally as a traditional, I would say, dentist, you're going to see. You're going to look at the symptoms, or there's a decay, a dead tooth, an infection, and you're going to stay on that level, just trying to treat that symptoms. And that's it. Patient comes, he has pain. Oh, you've got pain in your tooth. Let's try to kill the pain, and that's it. As a biological dentist, you try to look down and start looking at, okay, what's the root cause of that pain? What's going to trigger it? Is there something genetic in there? Is there a mental or emotional, spiritual influence? You have any bad experience before? Any trauma? Is it related after to your diet, the way you breathe, the exercise or not exercise you do? We're going to look at the meridians as well. If do you have any metal intoxication, for example? How do you sleep? I mean, it's all correlated. So you cannot, like it was before, go David.
Just for example, to give you a concrete example, if you come to a regular dentist and you have an inflammation of the gum, the conventional dentist may say that it's because you have a bad hygiene that gives you this gingivitis. But in reality, if, for example, you're pregnant, it's typically because you have a difference in your hormones that will lead to this gingivitis. So you need to look further to understand the hormonal imbalance or the genetic aspect of it. For example, if you have a periodontitis, it's linked to your genetics. So you need to look at what happened in your family to understand what can happen or what will happen in the future in your mouth.
Mm-hmm.
Yeah, so that is an interesting slide because it's we had a very important dentist called Dr. Weston Price. He used to live in the 1900s, and he was a brilliant dentist and a famous researcher. So he did lots of root canal, thousands of root canal treatment in his patients. And at some point, he saw that this root canal treatment was creating some degenerative disease in his patients. So he wanted to test his theory. So what he did is he had a patient one day, a woman that came to his practice, and she was suffering from severe arthritis, and she was in a wheelchair for 6 years. So he decided to remove the tooth, the root canal treated tooth. And he implanted this tooth into a healthy rabbit. What happened is that the rabbit in 48 hours developed severe arthritis.
Wow.
And 10 days later, the rabbit was dead. In the other hand, the patient's symptoms decreased considerably. So she could walk again and without a cane. So you see the difference, dramatic difference.
This is fascinating. How long, I never heard this story. I mean, I've heard of Dr. Weston Price before. How long did it take in his patient that developed degenerative disease from extracting to the root canal to developing disease? And then also for yourselves, how quickly do you think that can happen? Does it really depend?
I will give you a personal case. 3 years ago, I got a patient, a local patient, young patient. He was 17 at that time, from Ras El Khaimah. And he was having some symptoms, kind of autism. He came, so he couldn't walk, he couldn't talk, with his family to our practice. And I removed the tooth, the upper front tooth.
The symptoms started, I mean, the families, there's so many doctors, and the family started to realize that the symptoms appear just after, I mean, a few weeks after having a root canal treatment, because
Wow.
there's so many specialists and everything. And after, I mean, looking at all the details, trying to find out, going back on the history, they realized that actually the only medical act that was performed at that time was a root canal treatment on one of his front tooth.
Upper front tooth,
Yeah, on the upper front tooth. And so after seeing many specialists, they were like everybody, I think we all do that journey when you go to doctors and you can't find, I mean, you have no usually answers from the doctor, and everyone is a bit lost. So he ended up coming to the clinics, and it was really interesting because, I mean, I think, David, you can explain a bit more than me. As soon as you remove the tooth.
Yeah, the symptoms disappeared almost immediately. It
Wow.
took some time for him to come back to normal, but now, because it's funny, because I saw him 1 week ago, he's a bubbly young man. I mean, he's another person.
Amazing.
So you see how quickly it can change the way when you remove the root cause of the issue.
It's interesting because you have a picture here of the heart.
Yeah.
And it's well acknowledged in the medical field that if you're going to do any surgeries to the heart, because I know my father had that they have to check the mouth first.
Correct.
So it's well acknowledged. But why then is it so missed? Why are they still continuing to do root canals if they know that the mouth affects the heart?
Because of the focal infection versus the local infection. When you go to the dentist, you have a toothache. The dentist will focus on your tooth. And if there is a local factor, maybe the tooth is broken, fractured, then it's easy to find the root cause. But if the root cause of your disease is far from the symptoms, then it's much more difficult to find the root cause.
Mm-hmm.
Yeah, yes.
Yeah, what is the percentage? I'm not disputing what you're talking about now, but what is the actual percentage, the genetic percentage? Like you mentioned that you do an overview of your genetics beforehand.
Yes, I mean, it depends
What is
on,
the actual percentage that affects the person? Because I heard it wasn't that high, actually. It was more like epigenetics that were affecting the body, mind.
it depends on which disease. If you have a period disease, one of the main factor is the genetics. You have three main factors when you have a periodontitis. It's genetics, the smoking habit, and the stress issue.
Okay.
So it depends on the disease, basically, on the chronic disease.
Okay.
Because it doesn't play, it doesn't have the same impact depending on the issue. And it's true that all the external factors can play an immense role as well. For example, in orthodontics or in the way you breathe, I mean, all the mouth breathing, all the other issues as well. It's sometimes more, of course, external factors than the genetics. So it's really related a little bit, as David said, to the, what kind of disease are you looking at and what is affecting exactly.
Okay. I'll let you continue. Sorry. I know we have
no. So the question is, you know what the most common chronic disease is actually? And when you talk about chronic disease, usually you think about asthma, multiple sclerosis, but actually the first chronic disease is the gum disease and the decay. This is the most common, and that's affecting a lot of people. And usually it's not considered, or it's, I would say, it's taking more as a light subject because we have put the mouth so much a part of the body that people don't realize that it is a disease. When you tell to people cavity is a disease, usually they look at you with big eyes because they say, no, it's just a hole in the tooth. It's not, you cannot call it a disease. It is a disease because it has huge impacts.
Yeah, but the main chronic disease that we all know, like asthma or cancer or multiple sclerosis, we need to research what's the reason why we have an increase of this chronic disease since the 1970s. So is it the lifestyle? Is it the air we breathe? Is it the food that we eat? But anyway, all these factors have in common stress. So we need to understand what is the stress and what is your level of stress.
And there's different type of stress. I mean, usually when we say stress, we immediately think about, okay, the stress of everyday life, stress at work, stress in relationship. So that's why we call more the common stress, and which is the psychological stress. In the common stress, so you have the psychological and the emotional stress that's going to be triggered if you're in contact with a stressful person, where you're stuck in the traffic jam and it's very noisy and you start to get annoyed. But there's as well some other stress that can...
Husband?
Yeah. There's as well the electromagnetic field. We all know it's going to be different if you live in Dubai with the 5G or if you're lost in the mountain and there's no EMF. And the physical stress that can be caused by the body itself. So because there's an imbalance in the body, because there's toxins in the body, some allergens, and that's going to cause another physical stress. So which means that depending on your level of stress and how much your body can tolerate as well, you're going to develop different chronic disease. And
we also always say that the mouth is the open door to the rest of the body. And to give you an idea of the importance of the mouth to the rest to the body, you need to know that in the brain, you have cranial nerves that all innerve the body. And the mouth, this nerve is called the trigeminal, number 5. In the cranium, in the brain, the space that occupies the 5, so number 5, the trigeminal, is 50% of the nerve space. So imagine the importance that it has on the mouth. So what we know that if you stress, you have some consequence, of course. And one of the consequences can be bruxism, so grinding your teeth. And when you are stressed and you grind or you clench strongly your teeth, that may affect your teeth. And sometimes after a while, you can see that the teeth become smaller and smaller. And basically, the space that you have in between the nose and the chins can reduce. If this space, if this dimension reduced by 1 millimeter only, you will have few things. First of all, you will look older because you will see some riddle on the upper lip. Second thing is you'll have a face that is squarer because you will have so much developed masseter. But the most impacted things that you will have is that the mandible, which is the only mobile bone that you have in the body, will press strongly in the cranial box. And that affects because it will press on the vascularization, and that will reduce by 50% the vascularization of the brain. And that can lead, of course, to migraine, to headache, to brain fog, to this kind of symptoms. Fatigue as well. So you see how it's important to measure the occlusion, to measure the stress, the consequence of a stress into other symptoms that we don't see at first the link. And it was important to see a study conducted in Switzerland in a Swiss doctor office, because they checked and they saw that the majority of chronic disease were decreasing to a certain point until the point of mobile network coverage. And then it went up and up and up. So it's important to see that it can be related, highly related. And of course, when you're stressed, your body is tense and is in what we call sympathetic system. What it means is that we know that we have, for example, a healthy tissue. A healthy tissue, when it has some stress on it, it will have some disturbance that will lead to hyperacidity, and at some point to change of the cells itself, leading to a chronic disease and even worse sometimes. So our job as doctors is to change the sympathetic system into parasympathetic system. So we need to make sure that when you sleep, you relax, you eat good food, you know, these kind of things. But the problem is with EMF is that it disturbs the parasympathetic system when you sleep, for example. Mm-hmm. So if you have your phone, if you have your the TV on, or if you have the Wi-Fi on, all these kind of things will disturb your parasympathetic mode, and then you will not recover, and your immune system will not recover fully. So that's an issue. So we need to make sure that we always keep our patients into the parasympathetic mode. And we have few tips for you. First, use bed shield anti-EMF, then Wi-Fi off at night, use only wired earpod, airplane mode for your when you sleep, the Vivo-based device, and blue blocking glasses, of course.
No, but it's important because usually when we treat our patient, and for example, when we do surgical intervention or extraction of wisdom teeth, if we don't focus on all this as well, then the healing of the patient will be completely different than if you ask him to do this at the same time that you're going to do, I mean, the extraction, boosting his immune system. So we really have to consider everything at the same time. Otherwise, the healing of anything we're going to do in the mouth will not be optimized as well. So that's why it's important that when we see patients as first, that we check all this as well, and we give all this advice and tips. And usually you don't expect your dentist to do that and to talk about all these things, but it's going to have a lot of impact on your oral health, your microbiome, the way you're going to heal, your teeth are going to be remineralized, lots of things that we don't realize at first when you just go to the dentist for a tooth. So that's why it's nice to be able to bring awareness about all these different things that you need to do at the same time, so that everything is in balance, mouth included, and not taking the mouth completely out of the body.
Mm-hmm.
Let's be more dental focused, so that you see what kind of stress you can see in the mouth. So the heavy metal intoxication, for example, we have lots of metals that lead to galvanic currents, that leads to corrosion, that leads to antenna effects. So let's start with amalgam. Amalgam, as you know, or silver filling, as we call them sometimes, they are not silver at all. They are full of mercury. Mercury is a powerful neurotoxic, is one of those toxic metal on Earth, and it composes 50% of the mercury. So it's very, very powerful neurotoxic. And when you drink hot tea, or when you clench your teeth, you release some vapor of mercury on a daily basis. Small amount, but still, and that goes straight to your brain. And the half-life of mercury in your brain is 18 to 21 years. So it stays there. And that's why I advise always my patients, do not buy a property next to a crematorium, because they burn bodies and that the vapor of mercury is in their neighborhood. So yeah, be careful with these kind of things. The second thing is that if you want to remove mercury fillings, you need to have a specific protocol. We call it the SMART protocol. So if you want to know if you have a dentist close to you that is using this protocol, refer to the EIOMT website, and they have a list of dentists that use this kind of protocol.
Yeah, because if you remove it the wrong way, then you're just going to do worse than good, because actually you're just going to free all the mercury vapor in the mouth. The patient's going to breathe it. You're going to breathe it as well. The nurse is going to breathe it. It's really more toxic. But it's funny how they can, when we remove the amalgams, after they ask us to put the amalgam in a special box, you know, the hazardous box and things, and to give it to a special entity, when they were able to put it in your mouth without. And that's really where you have all the contradiction. I mean, like many other things, but this is, I mean, it should just alert you that when you do it, you have to give it to something specific, but to put it in your mouth, there's no precaution or anything. But it's really, really important that it's done the proper way. Otherwise, it's just better to keep it in your mouth, because if they do it the wrong way, it's really worse than good.
And I just want to highlight something about the IAOMT. You are part of that organization as biological dentists. But what I've noticed, and correct me if I'm wrong, is that not all dentists who are certified to use the SMART protocol are also biological dentists, correct?
Usually the dentists that use the SMART protocol, they are maybe not biological, but they have a tendency to look for the root cause and these kind of things. So they have already a tendency to be biological, but you can be
SMART certified.
You can be SMART certified and not using the proper tool still. So you need to do your homework, basically, to do your homework and make sure that they take the right precaution to protect you and the medical staff.
Yeah.
Okay, and so that's exactly what, if you can help members watching the recording or even on the line right now, what are these things that we need to be asking for to look for a proper dentist using that SMART protocol, who's using the proper tools? What are the key questions to be asking?
The question that you would need to ask is, what precaution do you give me before doing the removal of the filling? So if they don't give any charcoal, or if they don't prepare your body and your immune system for that, they're not ready for that. What kind of section they use? So if they use a conventional section, it does not work. If they just open the window of your dental practice, it does not work. We have specific tools and specific protection, rubber dam and a surgical section that lead to the protection of the patient. For example, I remember that we use our section during COVID time, and lots of dentists were wondering where they can buy these kind of things, because the regulation, the DHA regulation, wanted us to buy a kind of filter. But the filter that we have is not a standard filter. It's a proper hospital medical filter that really bring all the vapor of mercury. So these kind of things are very, very important. But once you discuss with your dentist all the protection that he's using, you will see that you won't have any doubt.
Yeah, you will see anyway your dentist coming with a mask like this, really like if he's going into an atomic section of a factory or something, because normally, and the nurse should have, I mean, not only the dentist, you as patients should be protected. So you're going to have the rubber dam in your mouth, which is going to cover everything. The nurse should be protected as well. And then at the end of the session as well, they should give you chlorella, I mean, just to eliminate eventually, I mean, any toxin you might still have and everything. But yeah, that's the kind of suction, what protection is equipment they take, how you prepare my body before, how you prepare how you make my body better after. So that's a little bit the clue and to ask and look at.
You can even
Okay.
ask them also how they remove the filling. Because if the dentist tell you, I will just drill the filling, that's not the proper way. What we do is we take a very, very thin burr to slide in between the filling and the tooth so that we can pop up the filling. We don't want to drill the mercury.
The full amalgam, yeah.
Because that's where you release the mercury vapor.
Okay, thank you. Bahare has her hand up. Please unmute yourself and ask.
Yeah, so I have a question with regards to silver fillings. I've had silver fillings ever since I was 7 years, unfortunately. And I've had them removed one by one in the past 10 years. Again, unfortunately, by my normal dentist. I wasn't aware by that time how the proper procedure has to be. And also that's actually the phase where all my health issues started, but that's a different story. I would like to know, is there any scan or is there any scan that I can do with you in your clinic, and I'm a patient of your clinic, just to ensure that all the fillings have been removed 100%. I mean, I have removed them and replaced them with the ceramic fillings, but still, I just don't want to leave anything out there. Is there anything I can do?
Yes, so basically we can do an X-ray, a panoramic X-ray or CT scan X-ray. The thing is we will only be able to guess if you still have mercury filling in your mouth or not, because it's it's just the radio opacity of the filling that will tell us if it's mercury, if it's another type of metal, or if it's a resin, for example. So it's just the variation of how it appears on the X-ray and the experience of the dentist that tell us if it's mercury filling or not.
And then after you can take, of course, the metals analysis, like blood analysis, urine analysis, hair testing, to see if you still have, if your body is loaded with mercury or not. That's the
well, currently it is. Currently it's loaded with mercury.
Yes, but you understand that you had this feeling all your life. So,
yeah.
And as I told you, the vapor of mercury is released every day. So even if you don't have any more mercury in your mouth right now, the fact that it stays in your body for the half-life is 21 years. So imagine it's difficult to get rid of that. So you need medical doctors to give you some protocol to release this metal from your body.
Yeah.
Okay. Are you following any detoxification protocol?
Well, I started my heavy metal protocol with Bernadette last year, but unfortunately I had to stop because I was allergic and I had like allergic reactions. I think it was the pea protein in one of the shakes, and so I stopped it. And anyways, by the end of the month, I have my root canal removal with
that's gonna help a lot.
Yeah. So, and then I'm gonna have another try with the protocol.
Yeah. You need also to check, Barry, the NICOS, because
yes, that's going to be done as well. That's going to be done as well.
Because we have lots of mercury as well in the NICOS.
Yeah.
And for those, I think you're going to be touching on that later. Do you want to explain?
On a later
get to that slide.
We have the full things. Yeah. What I wanted also to add in the mercury is, I mean, how do we know if students belong to a certain school? So they have a uniform, and in the body it's about the same. Each cell has a proper uniform that the body recognizes. But mercury has a potential to destroy this MHC. And then, of course, imagine what happens when a cell doesn't take your cells, that doesn't recognize that it's your own cells. So it has a powerful negative impact.
So I think we're going to talk more about now the cavitation.
Okay.
Let's go back to that topic. What is a cavitation? So this is the surgeon again.
So a famous biological dentist, Dr. Ulrich Folz, said that if you haven't had your wisdom teeth removed biologically, it's almost 100% sure that you have an ICO. What is it? Is basically when your bone, and when you remove your wisdom tooth, you're young, you're 20 years or something like that, and your bone will heal very quickly. But doing that, it will encapsulate parasite, fungus, bacteria. And then the bone will heal, but not really. It's going to be a necrotic bone. That's why we call it either cavitation or NICO. NICO stands for neuralgesia cavitational, induced cavitational osteonecrosis. And basically what it does is that you have a bone that is very fatty degenerescence and it's not properly healed. And that drains your immune system. So what do? We go back, we clean, disinfect with ozone, and put some PRF to obtain a proper healing.
And if anybody's interested in seeing exactly what that process looks like, you can go to my Instagram page. I have an oral health highlight and you could see my journey with exactly what he's saying. I had my wisdom teeth extracted unknowingly. You know, my mom thought she was doing the best. And sure enough, 3 out of the 4 were infected.
Yeah. We test them with the lab after that to make sure that it's
yes.
actually. Okay, dental implant now.
So once you have your tooth removed the proper way, let's switch to the next subject now, the dental implants. It's like, and the difference between all the different type of implants and which one is more biocompatible for your body, and what it means having a titanium implant in your mouth as well, and how it can play a role like an antenna with all the EMF around.
Yeah, so I don't know if you're familiar with the antenna effect, but basically when you have a titanium implant in your mouth and you use your cell phone, the temperature around the titanium implant will increase by 4 degrees with the 4G. We don't know yet with the 5G. Yeah. So imagine the corrosion, imagine the galvanic current, imagine the inflammation that you may have around it.
Yeah.
On the other side, the ceramic implant is biocompatible. There is no free electrons on the surface of the implant, so it's completely neutral. It's 100% free, a metal-free implant. It's white, so it's aesthetic, but it's non-toxic basically.
Yeah, and you don't have that. The things that you can have sometimes when you have a titanium implants, you don't have a metallic taste in your mouth as well. And the plaque buildup that you're going to have, that you can have with a titanium implant as well, you're not going to have it with a ceramic implants. So that makes a huge difference after on a long-term basis, and for the post-care about the implants as well. They're really healthier, easier to clean, and really more integrated in the body in a natural way compared to the titanium, where even so you have a few, I mean, the percentage of people that are actually really allergic to titanium implants is less than 2%. The rest of the things that it's going to do in your mouth, all the other little things, it's really worth, I mean, yeah, switching to a ceramic implants. And
it's a very hard implant, very strong implant. It's stronger than steel. And compared to the titanium implants, the long life is much better. Why? Because it's so much compatible with the gum. The gum like and love the ceramic, contrary as the titanium. And there is a study showing that after 5 years, there is an inflammation around the neck of titanium implants for 50% of the cases. So 1 every 2 implants will have what we call a peri-implantitis.
Mm. And so is a ceramic implant something that a conventional dentist could use? Is it the same technique to use a ceramic implant versus a titanium?
It's not the same technique. It looks like the same technique, and the distributor, unfortunately, sell them as the same technique, but it's not at all. It's not at all. You need to, it's 2 different materials. They work completely differently. And if you apply the same technique to one or the others, the ceramic implant will fail. Not necessarily the titanium though. So it's technically more easy to place a titanium implant because even in a non so healthy bone, the titanium implant will heal. It will heal. Not so good, but it will heal. The ceramic, say no. If your immune system is not perfect, it will not heal.
Now I understand why, because my husband also came to see you for removing a tooth and putting in an implant, and you had him wait. I think it was close to 6-7 months before he could come back and see you because you wanted to make sure that the gum was healed and ready for the implant.
Yeah, we take more time. We make sure that the patient has the right vitamin D level. We make sure that the immune system is perfect because it's a partnership with the immune system of the patient.
Mm-hmm. Yeah, because you're still going to put a foreign body in the system, even so it's biocompatible. So everything around needs to be healthy to be able to accept the implants. So that's why usually it's better to take time and to check all, I mean, especially the vitamin D, which is really important so that you can get really osteo-integrated. I mean,
yeah, no,
now, for members who aren't here in Dubai, who can't come to see you personally, if they want to go to a biological dentist and request a ceramic implant, is there a certain brand or is it all ceramic implants? Are they all equal? Or is there something they should be asking for?
They can ask the brand, definitely. We like to use the SDS brand because it's a clean implant. So the Clean Implant Association have selected few implants that are extremely sterile, extremely neat on the surface. So they've checked all those implants, and this one is selected for that. On top of that, it's a dentist, a Swiss dentist that has created this implant 20 years ago. So we have quite a long backlog on experience on this implant.
What is the name of the brand again? I didn't catch that.
SDS.
SDS.
Swiss Dentist Solution.
Ah, okay, perfect. Thank you.
Yeah, because there will be some other brand that's going to sell a ceramic implant, but actually the screw inside is metallic. So they have to ask as well that the full implant and the screw inside is as well in ceramic, because sometimes it's just surrounded by ceramic, but you still have metal inside. So even so, it's, I mean, better than the full.
It's like like the ceramic coated pans.
Yeah, exactly. It's exactly the same. They reproduce everything all around. Yeah. And something really important as well, when you want to do a surgery or placing an implant or doing the remove the Nikos, it's you need to check that your dentist is actually using the ozone as well, because that's going to help a lot in the recovery, bringing, I mean, oxygen to your blood. So that's the things that is typical, I would say, for a biological dentist to have in his practice. It's the ozone therapy.
Yeah, I just want to come back just one minute on the difference between titanium and implant, because I think it's important. The mouth is very particular crossroad between the external part of the mouth and the inside of the mouth. And this barrier is the gum. So basically the tooth is the only organ with one part in the outside, the mouth, the inside of the mouth, and the inside, the bone and all the tissues. The origin of the tissue is not the same. And so you need to have a very strong lock between the gum and the tooth. And actually, when it's healthy, you have two hemidesmosomes. So basically, you have two locks between the gum and the tooth. For a ceramic implant, you have only one lock because the gum attaches the desmosome to the ceramic implant. But for a titanium implant, you don't have lock. So you have an open door between the outside and the inside. So you have a circulation of bacteria between the outside and the inside on a daily basis.
Let's go back to ozone. No, because it's a very, very important tool that we can use. There's really lots of different applications for the ozone therapy. So you can have it as a gas. So ozone is it's oxygen that's been divided in O3 that you can use so as a gas, as a as water, ozonated water, in oil, ozonated oil, and you can have it injected in your blood as well in infusion. And there's one more, how do you call this?
Infusion in the ear, for example.
Yeah, infusion in the ear, but yeah. And it's so it's a very specific and natural tool that is antibacterial, antifungus, antiviral. So it helps a lot if you want to help to rebalance oral cavity. If you want to heal, for example, a necrotic bone, you're going to bring oxygen to it. It's going to so stimulate the blood cells, fight infections. So it's a super tool. And that's one of the first one you should ask if you go to a biological dentist, because it's going to help as well remineralize the enamel. So for children, that's an easy tool that is really well tolerated, easy to manipulate, and that's going to help a lot. So there's many applications as well. So if you want to check and see if your dentist, I mean, is a bit oriented or is a biological dentist, then that's what you can use as well. Are they using ozone therapy?
Yeah, so
that's like the health swap for antibiotics, because
exactly
normally anybody who goes to a dentist and does a conventional dentist and does any kind of procedure, preventative measures is right away to give antibiotics, but this can take that place.
Exactly.
Correct. Especially associated with PRF. Which is a next slide, I believe.
Yes.
Yes. So basically, PRF is what is we take your blood, we separate the blood cells from the white cells. We take the white cells because that is your immunity. This is your immune system. So we press it, we compact it, and that's the gold that we place inside the socket once it's been disinfected with ozone, and that will heal your socket because the socket is full with your own immune system, even some stem cells. You have 2% of stem cells inside, so it heals nicely. Imagine before, when I was not a biological dentist, my wisdom dentist used to take me 3 weeks of healing with antibiotic, with anti-inflammatory. That was the way I was educated. Now in 3 days, everything is done without antibiotic, without anti-inflammatory. It's healing nicely because of your immune system.
Yeah, I can vouch for that. I came to see you after you did my wisdom teeth. 4 days, and you showed me on that screen they were pink, like healed. I couldn't believe it. 4 days.
But there is no miracle. It's just Mother Nature.
PRF, it's your immune system, the immune cells
exactly.
that you're putting right there where you're cutting. So
that's why it's important to make sure before your immune system is at a stop, so that you can go through this and heal perfectly as well. But ozone was used, I mean, in World War I for disinfection of the injuries of the soldiers, so that they didn't get amputated. They said, okay, let's try that gas, ozone, and things, and that's how they discover it. And it was actually, I mean, preventing the gangrene to spread and everything. So they used to, I mean, they have the same many years of research on this. But it was at first a bit difficult to apply it to the dental world, because it's a very volatile gas. It's not easy to actually manipulate it or and have it. But now they've got new technology, and it's really useful. The way it works, I mean, the best for a patient as well at home, it's to use ozonated oil if you have ulcers or any cut in the mouth or leak in plan. I mean, anything. You just either rinse your mouth with ozonated water, or you apply ozonated oil on your injuries, and it works wonders, and no need for anything.
Do you have any brands that you like and recommend?
We're doing our own things at home. I mean, at home, at the clinic.
So you have two different type of machines. Yeah. You have the machine that use the oxygen of the air, basically. But then you have only 20% of oxygen, so it's not very powerful. And you have these machines where you have a tank of oxygen that's attached to the ozonated machine, and that is much more powerful because you're using 100% pure oxygen.
Yeah.
So that you can measure, you can add up, but be careful because the ozone is very powerful. So you need to measure, you need to make sure that it's not too ozonated. You need to select the right dosage for the indication, the mass wash or whatever, because you can burn and you can kill all type of bacteria, including the good bacteria. So we don't want you to burn all the good bacteria.
So again, those who don't have access to these machines, though, is there a brand that you used to use before you made them?
There was
specific brand.
I need to go. I need to double check. I need to double
You can
check.
always, if you can always.
Yeah, I'll send it to you later, Bernadette, because now that we're not using it anymore, I don't want to say the wrong name.
Yeah, I have one in mind as well. I think it's called Pure, P-U-R.
Yeah. There's a very good one from the States, but let me double check.
Okay, I'll add that into the recording. I'll add all the details in there.
But it's so that's a very, very interesting tool to use and to ask for, especially to ask for. If you have any mouth issue, ulcers, anything, infection, don't go for the antibiotics. Try to find, other solutions, because it really exists and you can use them. Oh, the nice topic, root canal treatment.
Yeah, root canal treatment. It's a big no for biological dentists. But let me explain what is the reason behind that. The tooth is made out of enamel, dentin, and the main canal. In the main canal, you have the vascularization, you have the nerve. But this dentis, this space that you have in between the enamel and the canal, is made out of hundreds and millions of tubules. These tubules, if you put them one after the other, it's about 3 miles for one tooth. So imagine it's just basically a channel that you have. And this channel is about 1 micron of diameter. So it's easy for the bacteria to stay there and to grow there and to release their waste, which are the endotoxin. So when you don't have healthy tooth, you don't have vascularization, you don't have the lymph that enter and wash away this kind of bacteria. So the thing is that when you have a root canal treatment, there's bacteria live there, and that's not very healthy, because that can go into the system, into the bloodstream, or through the nerves as well. It can go into the rest of the body. So what we want to do is either one of the technique is to get rid of this tooth, because it's a dead tooth basically. But we are trying to see the next generation of treatments where we will revascularize the tooth. So it's a new protocol called REP, and what we try to do is basically we're using, after the disinfection, so we remove, of course, the root canal, we disinfect the canal, and we're placing some PRF after disinfected with ozone. And we try to bring back the vascularization inside this tooth. So of course you won't have the nerve is gone, but if you have a blood flow, then that will revitalize the tooth. So that's what we want to do now.
Oh, wow. And have you started doing that?
So we have a very good dentist that we're in touch with in Spain. He created this technique for immature tooth. We've done that many times for immature tooth. So when the apex, when the tip of the root is not finished, it's quite open, we do that quite often, and that works well. Yeah. But now we're trying to do that for
that's the case for the children. For example, if you have a child that fall on his permanent tooth and is like 8, 9 years old, the permanent tooth is not fully formed yet. So which means you're going to have the crown, but the root of the tooth will still be open. So that's when you try to use this technique, because the tooth is young, because it's a young body as well, so fresh cells, everything is full of energy in there. You try to bring back the flow, and you can bring back the nerve sometimes in that case. And now what they're trying to do is to do that as well for adult teeth, and with using the techniques and see how it works, because we still have to realize that it can be sometimes very difficult psychologically for a patient to know that, like, okay, you have 10 root canals, you need to remove 10 permanent teeth. Yeah. There's a psychological effect on this as well. So you have to try to realize that it might not be possible at one stage. So we need sometimes to find a solution to keep that tooth, the dead tooth, as healthy as possible, just for the time being, so that everyone is ready and the body is ready as well, and the mind is ready to eventually get rid of all these teeth. So that's why there's still some cases when, unfortunately, you have to go through the root canal phase, but then you have to do it the same in a very biological way. So you need to use ozone to rinse the canals. You need to use the laser therapy, because it's going to kill the germs that are eventually sitting in the bone as well. And you might be able to keep that tooth a little bit longer. So That's why it's important as well, I think, when we discuss with patients and even so your biological, to consider all aspects of the body, especially as well if it's a front tooth, for example, because everybody is not ready to have a front tooth removed. I mean, when you're young and things. So there's lots of things to look around. So that's why we're trying really to find a solution and in between when you can make that body still healthy, to try to keep it and buy time as well, because that's a huge concern for children as well, because you won't tell a children of 13 years old that, okay, we're going to remove your tooth because it's dead and things. So it's a very interesting field, and there's lots of evolution. So hopefully there's hope that we can, with maybe stem cells and the PRF and things, try to bring back, I would say, life in there for a dead tooth. That's going to be a very good.
What is that? What is it called again? This form of treatment?
REP. So it's called, yeah, REP stands for Regenerative Endodontics Protocol. I call it Revitalization Endodontics Protocol because it gives life back to the tooth.
And so this is something that somebody can ask for, request for.
Yes, yes. Now we're doing that at the clinic, and the only thing is the indication. We choose now only certain type of teeth. The front tooth is perfect because it has a very straight canal, and we can enlarge the tip of the canal. That's what we need to do to bring back the blood flow. Amazing. If it's a very back tooth, back molar with curved teeth, it's more
very
challenging.
Complicated. Yeah.
Very interesting.
Yeah.
It's nice to know that that there is another solution other than just.
Correct.
That's very promising.
Is there a question, or because I see Roze?
I think she just didn't put her hand down.
Okay.
Leaky gut, leaky gum.
So it's your subject, Bernadette. How the leaky gum can spread into the leaky gut, because I mean there's been lots of interest on the guts the past few years, but the same, we have, I mean, the mouth bit's been kept on the side a little bit. Even so, of course, they're so linked because they are, I mean, you can't separate them. And whatever happens in the mouth, which is the open door to the body, is going to have a repercussion after later on the gut. So really the mouth is the mirror of the body. So whatever unbalance you're going to have in your oral microbiota, you're going to find it back in your gums, in your guts, sorry. And the same bacteria is going to travel if the barrier doesn't happen, or if the saliva doesn't play its role. If your immune system in your mouth or your teeth don't play their role, it's the same. You're going to just transfer the imbalance into your gut. And it's funny to realize as well as, I mean, there's been lots of studies where a bacteria that can be toxic in the gut is actually a bacteria that's in the mouth, keep under control, and that won't be toxic. But if you have a solid barrier, and like David was saying, if your tooth has that, the lock in between your gums and the tooth are solid, then you won't have, the bacteria will be left inside and there won't be any interference. But if you don't have these lock, if you can see like on the screen, the little drawing down there, then that's when all the bacteria is going to transfer and create another imbalance in another part of the body. Mm-hmm. So it's a very interesting subject, and that's why the same, the first things to do as well is to check your oral microbiota and see if there's any imbalance in there and how you can adjust it. So what's going to be, I mean, what's going to imbalance your microbiome in your mouth? There's many things, and it's always interlocking. So it can be the way you breathe, the food you eat, of course, your saliva, the medication you eventually take, if you're smoking, of course. I mean, there's lots and lots of things that interact. The type of liquid you drink as well, lots of water, not water. And so we need to address all these specific things one by one to check and make sure that you've got that right balance in your mouth. So even so, you have, I think in the gut, it's 300 trillion bacteria. And in the mouth, you only have 20 billion. There's still a lot of interaction between them. And you need to start first with, checking your mouth. And
yeah, you need to know that also in the mouth, you have two types of gum.
Yeah.
You have the attached gum that surround the healthy tooth, and you have the non-attached gum. And if we have attached gum everywhere, that's perfect. But usually around the wisdom teeth, you may have this non-attached gum, and that's an open door to the gut, basically, because bacteria can go into that. And that's why we prefer usually to remove the wisdom teeth where the gum is not perfectly attached all around, and because you have gingivitis in this particular area actually. So we need to be careful with that.
Yeah. That's up.
Okay. And
The meridians.
Yeah.
Yeah.
So basically, the idea is, do you have any issue with your thyroid that may be linked to the upper molars? Do you have any issue with your back knee that could lead to the lower premolars? If you have an issue with the front area of the knee, that could be a reason of an infection on your front teeth. So you need to know this kind of relation between organ and which tooth is considered.
That's how the meridians work. Like each meridian's gonna go in a specific tooth, tooth area. And that's the same as a biological dentist should check, is that which tooth is linked to which organs and how it can affect an organ, especially, but the same with root canal, you can really link it to thyroid. You had an example as well with a lady with a thyroid issue and
she had a thyroid issue. She was very young. She was 26, and the doctors wanted to remove a thyroid because it didn't work, and they tried many medication. And basically, once we have removed it was a first molar, right first molar, and then the solution. The symptoms disappear. So it's really important. And it's basically meridian are energy wave going through the facial muscle. So what we do in Europe, we try to use one type of anesthesia that will block the relation of this meridian. So for example, if you have any symptoms in your knee, we give this shot of anesthesia in your tooth related to this knee, and we see if there is any relation. If the symptom disappear, that we know that the relation is because of this infected tooth. Yeah.
So now let's go back. We're gonna go there. Voila, how to keep your oral microbiome well balanced and healthy. That's the most important thing. So the first things we have to look at is what cause, of course, the disrupted oral microbiome. One of the most frequent things is actually the saliva. The saliva is going to play a huge role in maintaining your microbiome healthy, because the saliva, of course, your teeth are supposed to bath in saliva. So if they're not, the mouth is more dry, which means the remineralization protocol cannot happen with your teeth. And then which is going to completely change as well the type of germs that you're going to have in your mouth if your saliva is not efficient. So what can disrupt the saliva? If you're mouth breathing, if you take some medication, if you're not drinking enough, lots of disease as well that you can have that's going to affect the flow of saliva. So sometimes you need to have to re-stimulate it. After, it's your habits as well. If you have, of course, poor oral hygiene, if you're smoking, depending on the food you're going to eat as well, acidic food, the frequency of food you're going to eat. You have to know that it takes approximately 30 minutes for your saliva to remineralize your teeth, which means every time you're snacking, then your teeth's gonna be in an acidic environment, because your saliva is supposed to keep your pH in your mouth neutral. So for example, children that are snacking every 30 minutes or 45 minutes, they won't be able to let the processes of remineralization happening, and that's how they're going to lose all the minerals from the teeth. So there's lots of different factors that you need to look at to make sure that you're going to keep balance. A good thing as well that sometimes we don't think, because we think a lot about probiotics for the guts, but we forget that you can have as well probiotics for the mouth that are different than the probiotics for the guts, just to help as well rebalance the level of good bacteria and reduce, of course, the level of bad bacteria and remake the balance there.
Yeah, one tip that you can use as well is a specific toothpaste with hydroxyapatite that will remineralize the teeth, but not only that, it will rebalance the pH of your saliva. So that has many effects on the mouth, on the saliva, on the pH, And to rebalance your microbiome, it's one of the best tools that we have. But of course, you have to choose a specific toothpaste that contains a high level of hydroxyapatite, like Boca, for example, or Risewell.
Yeah.
What is the percentage of hydroxyapatite? That
Ideally, it should be 10%.
10%.
10%. All the studies that they made regarding the efficiency of hydroxyapatite compared to fluoride were made with 10% of hydroxyapatite.
Yeah.
So that's
Yeah.
the level you're trying to look at. Yeah.
I'm starting to see a lot more brands jumping on the hydroxyapatite.
Yeah,
bandwagon.
now, yeah.
But
Probably.
it's like the last ingredient, you know, so it's probably 2% or something
Yes,
very
but
small.
that will change again because you have hydroxyapatite, micro element of hydroxyapatite, or you have toothpaste with nanoparticle
Yes.
of hydroxyapatite. So I would not go for nanoparticles, and most of them are nanoparticles. But the nanoparticles will probably be banned in Europe. It has some cytotoxic effect. So what we need to look for now is the other type, the hydroxyapatite with micro element.
Particle. Yeah.
And so what would that look like exactly on an ingredient label? So for example, I think Boca and Risewell, do they use the nano or not?
Nanoparticle, yes.
Yeah.
Nanoparticle.
They do?
Yes.
Yeah.
Because it's still and
Because-
will still be allowed in the US.
Yeah, it's Europe. Europe is doing that for now.
And so what are they going to be replacing it with?
With microparticles. You have,
microparticle of hydroxyapatite.
Yeah.
Same, but just the type of particle is different.
So basically the nanoparticle is 5 to 200 nanometer. The
Okay.
microparticle is, I don't want to get wrong, is 5 micron. So if it's basically 1,000 times more bigger. And
Okay, so
that
it's a
doesn't
bigger
go
size.
into the organs and the
So
tissue.
are you no longer recommending Boca and Risewell because of that?
Still, because it's better than fluoride.
Yeah.
And yeah. So for the moment, it's a much better alternative, and it actually has an action on protecting the teeth. So it's still our best option for now, because if you go purely to only herbal toothpaste, you don't have that action if you want to remineralize the teeth. After, it depends, because if someone's got a healthy mouth, healthy microbiome, everything is going well, actually just, brushing your teeth, even without toothpaste, will do the job to remove all the food particles and the plaque. And but
they're still the best in the market.
They're still the best in the market for now, and the less toxic if you want to remineralize the teeth. And so
That's good to know.
And actually,
Wow.
it's much more powerful to have a nanoparticle. So basically, this nanoparticle has a biomimetic effect. So it replaces the enamel that has been lost.
Yeah.
So it goes there. So it's less effective with microparticle, but it doesn't go into the cells level. So it's not cytotoxic. So that's why we want to go into the upper level, and that works as well, very well. And there have studies now showing the benefited effect of the microparticle.
Okay.
No, and they've been using it in Japan since the 1970s, I think.
It was invented by the NASA.
Yeah. So which one is used? The microparticle or the nano?
In Japan, it's a particle, the microparticle. In the US, it's the nano.
Ah, okay. Interesting. So why would is it cheaper, or it's just because it's more effective?
Yeah,
it's more effective. Yeah, it's more effective.
And it's probably easier as well to include in a toothpaste formulation. But they've got, I found some South Korean one toothpaste, Bernadette. I'm going to send you the details that are quite.
Please don't share that with everybody.
Yeah. That's going to be interesting. So let's go back. I think we talked about the saliva already. Yeah, how you can get your saliva. I think probably know that you need to get your saliva tasted to make sure that you're still in the neutral pH in your mouth. Otherwise, if you're too acidic, the same. You're gonna create an erosion of your teeth. You're gonna increase the level of some bacteria that can be pathogenic, and then you're gonna reduce the bacteria that are gonna protect your teeth. Same on the other side, if you're too alkaline, you're going to create some other imbalance in your mouth. So if you feel like, because sometimes people say, I keep brushing my teeth, I keep flossing, and I still have cavities, check your saliva. The saliva plays such an important role that it might be something that you need to look at, the saliva and the mouth breathing. That's the two things usually we forget, and we focus a lot on the diet, like, okay, the amount of sugar you take, the amount of acidic food you take, the fizzy drinks you drink, but there's a lot of things that have to do with the breathing and the quality and the quantity of your saliva. That plays a huge role. So that's something you need. You can't only focus to the food, which that's what we've been told as traditional dentists before. It's mainly the diet and your brushing. You've got cavity, you're not brushing enough, or your diet is just bad. It's much more complex than that. So that's why in the same family, when they're mainly eating the same thing, even if there's a part of genetic, you're going to have children that have nothing and some other that keeps having cavity. So you need to go through and make sure, go through all the different things that can have an action on it. So the saliva and the mouth breathing, that's the two things that are not addressed well enough nowadays, and that we really need to focus on, because they play a huge role in the protection of your teeth and the balance of your oral microbiome in your mouth.
Almost finished.
So how to maintain a healthy saliva quickly? Of course, they're well hydrated. Keep drinking water, mainly, most importantly. And all the food that's going to help you as well to watermelon, for example, or celery, they're going to help you stay hydrated as well. Careful, the same, less saliva if you're breathing through your mouth. So make sure you try to work on your nasal breathing and avoid the mouth breathing. What's going to cause nasal breathing quickly? It's mainly going to be, there's going to be allergy that can create that. You have to know that for a child, once, for example, they've been sick and they had a cold and they've got their nose is congested, they're going to switch to mouth breathing, and it's easier to breathe through your mouth. So they're going to keep that habit later on, even so there's no congestion in their nose anymore. So that's something you have to re-educate. Of course, check with your ENT that your nasal airway is free. So that's something important, to be able to check that you can actually properly breathe through your nose. But otherwise, it's really something that you need to educate later on, like to relearn breathing through the nose. That's really, really important, because it plays the same role. You have some little hair in your nose. So when you breathe through your nose, the bacteria that you're going to breathe are going to get stuck to this little hair. And after, you're going to get them out of your system. If you breathe through your mouth, you're just going to swallow them. There's not going to be something that's going to stop them from going inside. So it's an all different system. Stimulate your saliva, chew a lot. So sugar-free bubble gum are okay if you have an issue with your saliva. It's better than nothing, because it's going to stimulate and mechanically helps to clean your teeth as well. If you really have an issue with the flow of saliva and you don't know why and you need to improve it, there's some artificial saliva product that you can use as well to stimulate it a little bit. Mouthwash are a big no-no. All the commercial mouthwash and everything, they're just gonna kill your mouth. Kill all the germs in your mouth, the good ones and the bad ones. So please don't use it. There's lots of natural product and natural mouthwash that you can use to clean your mouth. Related to the bad breath and things, there's lots of things. Green tea is a very good thing. You can do a mouthwash with a green tea. It's full of antioxidants, excellent for the mouth. What else you can do? Baking soda as well can work sometimes. And can saliva damage the teeth? Sometimes, yes, a lack of saliva can really damage the teeth, or saliva that is too acidic can damage the teeth as well. So that's something really to look at, because it's going to help a lot.
Yeah, actually, when patient has they have oral cancer, unfortunately, and they have some irradiation, and this irradiation kills the salivary glands, and you see that the patient doesn't have saliva anymore, and then a lot of cavities at the edge of each tooth is appearing, so that immediately you have lots of cavities, unfortunately. So we give them some products like Salif Plus to have artificial saliva in the mouth.
Yeah, and continuous hydration as well. Let's see what we're going to share else. That's the So how to manage your teeth at home? Quick resume. So choose the right toothpaste. Okay, floss as well, really important. I know it sounds very annoying, but that's going to help a lot. And I know it's something that is really difficult to do on an everyday basis. If you really want to rinse your mouth, Either you do the DIY mouthwash at home, and now I'm going to share some recipe with you, Bernadette, so that you can share, or you can buy the one from Roze is quite good, the alkaline white. After, for any gum issue, even to help remineralize the teeth, you can use the ozonated oil. And don't forget, for your teeth to be healthy, for the calcium to fix on your teeth, you need to have a combination of supplements. I mean, a combination of minerals that's going to work together. So D3, K2, calcium and magnesium for your teeth. So that's something as well that we need to check and keep an eye on. There's a lot of vitamin D deficiency that we see in kids as well. And of course, then they're not going to fix the calcium on their teeth, and they're going to have weaker enamel. We see the same, for example, a pregnant woman that is deficient in vitamin D, her child's going to be, I mean, when the teeth are being built in the wound, you're going to see a weaker enamel on the baby teeth, on the primary teeth when the child, I mean, when they start to erupt. So lots of information as well to give to a pregnant woman. And after, there's some tooth powder as well that you can use, but it's more, yeah.
What is that?
It's to replace a little bit the toothpaste. It's another way to clean the teeth as well. But there, I mean, I didn't find one that's got really minerals in it. So it's a different way, more for herbal solution to help. So they've got good ingredients, for example, to freshen the breath or things. But yeah, it's not my favorite type, honestly. But that was the nasal breathing, but maybe we're going to pass a little bit. Yeah, my favorite subject. Why is my child mouth breathing or snoring at night? Yeah, so we mentioned it's a little bit allergy, obstructed airway. Another thing to really look at is the tongue posture, the way you put your tongue, and look at the tongue tie. You know, there's like a little piece of skin, like a frenum, that's going to attach your tooth to the bottom of your mouth. And if that one is inserted too high on the tongue position cannot be correct, which the same is going to have a lot of impact on the way your mouth is going to develop, on the way you're going to be able with your speech. And then, of course, because your tongue cannot go up at night, you're going to stay the mouth open to breathe. I mean, lots of different things as well to look at. And then suck. Of course, but that's going to check with the ENT usually if you have any enlarged tonsil or adenoid. So make sure the nasal airway is free, as I said before, to make sure you can actually properly breathe through your nose.
And in adults, because I know that you're talking this for children, but in adults, if there's is there any solution if it's an issue of tongue positioning? Is it mouth guards? What
no, you can check. It's really, you can re-educate your tongue.
Re-educate.
Yeah, exactly. If your tongue is free of its movements, so it's not too tight or too attached too tightly to the bottom of your mouth, it's a question of re-education. And so you have to do some exercise. You go see a myofunctional therapist, and you're going to do some exercise to your tongue. Put your tongue up there, try to make it move all around, swallow, because sometimes some people, adults, are keeping what we call a child way of swallowing. So you don't put your tongue in the right position when you swallow. You're going to keep pushing on your front teeth instead of having your tongue going up on the palate. And that's something you can re-educate. Yeah, there's sometimes some myofunctional appliance as well that you can use during the day or at night. The same, just to help your tongue find the right position.
Now we can see that you're passionate. Huh?
And if your nasal airway is free, then you can put a scotch tape, you know, the mouth taping.
Mouth tape, yeah. Bernadette, you have a question?
Did I raise my hand?
Oh yeah, okay, it's still
I
up.
think it's still still
I
raised.
saw it come back up, but I think I saw somebody else. Daniel, did you have a question? Daniel? No? Okay, I thought I saw somebody else put their hand up. Yeah, go ahead.
Yeah, so that's how we cover briefly a little bit all the subjects. But yeah, if you have any question, please, or if you want us to go back on one subject.
Well, I'd like to go back to mouth breathing for a minute here, because this is a subject that I'm personally very interested in at the moment. I'm reading the book Breath by James Nestor. I'm not sure if you've read that. So it's all very fascinating to me. How much of this does it play in the conventional dentistry world versus biological? Would anybody who's having breathing issues go see a dentist? Is that something that you would recommend, and what do you necessarily check for? Is it tongue positioning, jaw positioning?
Yeah, you check.
What is
Yeah,
your
the first things you should do is go see an ENT first.
Okay.
First, you go see an ENT to make sure that there's nothing blocked. It's not an anatomical issue. Like you don't have a deviated septums, enlarged adenoids. That's the first thing to say. When you're sure that the airway is free, it means, okay, you just have to work, either on your tongue positioning. So you do some exercise, mouth taping as well, first during the day to make sure you feel comfortable breathing through your nose. And then slowly you do it at night. There's some, as I said as well, some functional appliance that you can wear that's going to help you, that's going to a bit seal your mouth to force you to breathe through the nose. You need sometimes as well to work on your muscles, because some people's got low tone muscles there, so you need to re-educate there. So that's why it's a myofunctional therapist that you should see. And after, because you're going to see it as well sometimes with the position of the teeth, which means your mouth breathing, your tongue is not going so high on the palate. So you have usually a narrow palate, and you don't have enough space for your teeth. You have a tendency more for crowding, or sometimes even grinding as well, which can be a little bit contradictory, but still. So I would say, see all these different specialists, the ENT, the myofunctional, and your dentist as well. Okay. But conventional dentists are not looking too much into that for now. But I think, as you said, it's becoming a big topic. So hopefully more and more people will be aware and start checking this, because you can really, when they're young, you can really interfere and improve this before you get to the stage of an adult. And it's more difficult, of course, because the habit is there for a long, long time.
Yeah.
Check
and
allergies as well. Check allergies.
Yeah, it's something that you don't think about. So as a parent recently, when it really came into my consciousness and my awareness, I asked my children, do you breathe from your mouth or do you breathe from your nose? And then I was curious. I just started observing them. I don't think we think about it, right? Unless you actually make a conscious effort to look and stare at your children and see.
You're going to think about it if you hear them snoring, you know, that's the moment you say, oh, it's funny, snoring at night, or this kind of things. But otherwise, no, you don't. It's something, I mean, breathing is something you do naturally without thinking of how I do it, actually.
Right, exactly. But it's very important. So I'm glad.
No, it has a huge impact on lots of things. I mean, yeah. And when you breathe through your nose, that's when you're going to have the nitric oxide as well, I guess. And that has another, I mean, yeah, we can continue on the subject.
So there was a question that was asked on behalf of one of the members that's not here tonight. And her question was, when she was a teenager, now she's 40, she had an eating disorder. So anorexia, bulimia for 20 years. Is there anything that she can do as to not have these consequences from past disorders? So is there anything I can do to not have the consequences from past disorders, like the loss of the enamel, for example? So is there anything that she could do currently, something that may have affected, obviously, the eating disorder may have impacted her teeth? Is there anything that she can be doing now to help correct it and prevent future damage? It
depends a little bit how much they've been damaged, because usually you have a lot of erosion when you had an eating disorder. You've got lots of erosion phases on your teeth. So it depends a little bit how far it went, but otherwise it's really to follow a remineralization protocol. So try to, whatever is left of the tooth, remineralize it at a maximum so that it stays harder and you don't get any sensitivity. So I really go into that and try to, check that the oral microbiome is well balanced, that the acidity of the saliva is at a neutral pH as well. Eventually check some oral probiotics to make sure, and remineralization protocol for the teeth.
After that, it will depend also on the symptoms. So if she has a lot of sensitivity, you have the remineralization protocol. You can use also ozone to decrease the sensitivity of the teeth. Now, if it's extreme, and we have seen some extreme case where not only you have erosion from the back, but also from the top. And then at some point, we can protect the tooth, not to drill, but to place something on the tooth, like crown to protect the tooth from sensitivity. So we don't drill the tooth, we try, or minimally, but what we try to do is to protect the tooth in the long run.
And you mentioned remineralization protocol. Can you just, is that somewhere in the slides, or would you mind sharing what that is?
I don't remember if we put it
I
in
mean,
the sum- yeah.
we need to start with using the right toothpaste. So Boca or Risewell is one of that.
Okay.
We have also some protocols, but that we do in the clinic to remineralize and desensitize the tooth itself.
Yeah, so you put mineralizing paste, you use the ozone, depending on the sensitivity, you do different session to help, either the ozone gas or at home, the ozonated oil. Diet as well, extra cautious with any food or drinks that can be a bit acidic, and that's going to create more erosion. So really try to, take more of the alkaline food as much as possible. Checking, really depends on the severity of the case, but there are lots of things that you can do. It's
the habits has to be also changed sometimes. So for example, we change the toothbrush. We try to use only surgical toothbrush. That way we just massage the gum and not aggress.
No, we're not as aggressive as
Okay. And in the meantime, soft, right? We should not be using hard bristle brushes.
No, I know we feel that we need to brush like crazy to be efficient. Not at all. Not at all.
Not hard, not even medium.
Yeah. Only soft, gentle with your gums.
From the red to the white.
Yeah, always trying to push the gum back on your teeth and the other way, which is not a natural way to do it. So you really have to think about doing it before it becomes an habit.
Yeah. And you mentioned oral probiotics. I know that when I came to see you, you had recommended the brand called
Dentasan, a German brand. Dentasan. Yeah.
I'm sure people are going to probably ask that question. So
No, I'm going to give you the full list of all the things we recommend.
Amazing.
And,
amazing.
The type of toothpaste.
We can also send you or to your followers some sample. We can ask some sample of Dentasan. That's good.
My members are all over the world. I don't know how we're
Okay, for the ones located in the UAE. Sorry, favoritism.
Saif has a question. Saif, go ahead, unmute yourself.
Yeah.
So I had a question. I just wanted to ask, are there certain medications that increase the susceptibility of having cavities?
Certain medication that? I didn't hear you, sorry, that?
Increase the susceptibility of having cavities.
Certain medication, because they're going to reduce either your saliva flow or because they've got sugar in it as well. Then they can increase your risk of cavities.
You can even have your mom taking some medication during the pregnancy that affect your teeth.
It's going to affect the quality of your enamel, which is going to make your enamel more susceptible to get decay later on in life. So definitely, some medication can do that. An excess of fluoride as well can do that.
Okay. Thank you so much.
Bahare?
Yeah, I actually do have a question with regards to surgery. So since mine is hopefully coming up soon, what do you recommend as a protocol post-surgery? So for NICO and root canal removal?
So you remember that we boost the immune system of the patient before. But once the tooth has been removed or the NICO has been cleaned, we use ozone on the day of the surgery to clean the socket, because it penetrates up to 2.5 centimeters inside the bone. And then we use PRF to fill this socket. But after the surgery, what we do is we recommend not to use antibiotic, never. And rarely painkillers. I mean, it depends on the tolerance and sensitivity. But we recommend as well to use things like turmeric and black pepper during your food. And we will see you 3 or 4 days after the surgery, where you will see Julie. She's our facial therapist. She will do a lymph drainage. So she will drain your lymph so that it heals in a better way. She will also use red light therapy, and she will press acupoints to relieve the tension. So this
okay, so And do you recommend, because I have a Therasage ozone bubbler and I also have red light. So do you
Yeah.
recommend that I continue doing these at home, or is
The
it
red light
enough?
therapy, definitely. Yeah.
No, we recommend to do that. Another thing
Okay.
that I didn't mention, but it's something that you will benefit, is the immune boost infusion. So usually we offer immune boost 1 week before the surgery and 1 week after the surgery, and
Okay.
that boosts your immune system, and you
Together,
benefit from that.
And that's through
Oh.
IV, right?
Yeah.
You're doing IV
Right.
infusion.
Yeah, IV infusion, sorry. Yeah, yeah.
Oh, great. Okay, perfect. Thank you so much.
Lots of rest and not too much stress. It's going to be fine. I know it's always a bit scary.
Oh,
but,
I'm sure
yeah.
I'm gonna stress beforehand, so.
But
You're in
actually,
good hands.
the session that you will have with Julie will change your stress mode, so the sympathetic mode, into the parasympathetic.
Parasympathetic, yeah, great. Thank
Yeah.
you.
Yeah, and just hearing you guys speak and the whole process, it's so different. It's so, as you mentioned at the beginning, that's truly the difference between conventional dentistry and biological. It's the A to Z holistic approach to healing. It's not just, here's the tooth, let's manage the symptom and off
Yeah.
you go. It's a patient-doctor relationship and a process of before, during, and after. You know, I think that's really the biggest distinction between the two, which is
Correct.
great.
But I mean, everything is connected, Bernadette, as you know. So
Yeah.
it's very important that the patient realize that, because it's 90% is homework. I mean, lifestyle. How can you judge if the patient has this kind of lifestyle or not? That will depend. The healing will depend on that.
Yeah.
The what he eats, what he drinks, what kind of exercise he's doing, how he think
Yeah.
makes a difference.
Yeah, because we all know about the placebo effect, but there's as well the nocebo effect. So if you
Mhm.
constantly feel negative about, oh, it's going to be terrible, I'm not going to heal and everything, we know it's going to have an impact, and we can see that on patients that are doing that, but you can, and this is something we can't control, but we need to address it and we need to discuss. That's why, I mean, the first consultation is super important. It takes so long because you have to go through all the different things to make sure that, I mean, the body is ready to get that intervention, and that whatever you're going to do is going to heal well and will be well tolerated. And you're looking at long-term, I mean, effect, and not just, as you said, you come, oh, you pain on that tooth, let's look at that tooth, and that's it. So it's really important. Yeah.
Amazing. Thank you both. Does anybody have any other questions?
Yes.
Daniel?
Yeah, I tuned in a little bit later, so maybe you have answered the question already. I'm not sure, but my dentist said that the layer of my teeth, the top layer, I'm not sure how it's called, that it's eroding fast for some reason. But she even thought I had diabetes, which I don't have. I don't know why she thought that, but she said that this type of complaint of this type of eroding, she's only saw with diabetes patients. I'm not sure what she meant by that, but I was curious about your vision of this. What is this, and is there something you could do about it?
Yes, so the whole point is to find the root cause. So the whole point is to understand why, first of all, is it the enamel that is starting to erode, or is it the cement, so the root part of the tooth that's starting to erode? Do you have a gum recession? And do you drink acidic water like lemon juice every day? You know, we need to ask all these questions.
All the sports drinks as well.
Sports drinks
can do that.
Anything.
And after, yeah, it depends on the, maybe you have too much acidity in your mouth, so it might come from your saliva.
Or reflux.
Yeah, or acid reflux as well. That's going to make your saliva more acidic. So you need to start to check the pH of your saliva first as well, to see, because if your mouth is constantly in acidic, that's, you're going to have a natural erosion. It means the minerals are getting out of your teeth and they're not be put back by your saliva. Are you grinding at night as well? That's gonna the same, reduce a little bit and erode your teeth. Yeah, it can be lots of different things actually, but you really need to go through all the little ones one by one.
And you need to help your doctor investigate that, because maybe you're doing something that has this kind of impact on your teeth. So we need, I mean, you need with your dentist to work together to try to find the root cause of the issue.
So I would look at your saliva. I would look at what you drink, the way you drink, if you're taking any medication or not. Are you drinking any sports drink or not? Any acid reflux for your stomach as well that can make your mouth more acidic? How often do you eat food? I mean, there's lots of things that needs to be investigated.
One of the things that I would recommend, and that's what we do when we do biological cleaning, is to do a blood test. Then you can test the CBC, so the whole count of the blood, but you can also check the LDL level and the vitamin D3 level. That way you will have a good indication of if you have any diabetes or not. Or if you have any other symptoms. But you understand, you try to go deeper and deeper. Each level gives you some indication to go to the next step.
Okay. So even insulin.
If it's a general disease, then you need to work, or your dentist needs to work with a functional doctor to make sure that we don't miss anything.
All right. Thank you.
Most welcome.
Most welcome.
So this actually raises the issue that I'm sure many of my members are probably thinking, how can I find a biological dentist, or would love to work with you? I know that you offer, I believe, correct me if I'm wrong, virtual consultations for those who are not located here in Dubai, is that correct?
Yes, but if you want to do online consultation, first you need to go to a dentist or ask for your previous X-ray, because we do the online consultation based on either the CT scan that you have or the panoramic X-ray. But we need a support, radiological support, to be able to do this kind of online consultation.
Okay.
And then after that, we explain what you have, and either we help you try to find, because we have a
network
of biological dentists, or you want to come to Dubai because it's more convenient for you, and we do what we call the BioHealth Week. So for 1 week, we'll make sure that we do everything.
And we work with functional doctors as well. Because it has to be with a functional doctor. So if you have your own functional doctor at home, then we can link with them and things. But it's a teamwork around because it's as we said, the mouth is connected to the body, so there's multiple relations in between the mouth and the body. So we need to target that.
Excellent. And will you be able to share? So if somebody would like to reach out to you to, you know, they have their X-ray, they have their panoramic X-ray, and they would like to consult with you. Will you share the details with us so that I can share that as well?
Yeah, definitely. That's something we do anyway. Yeah. No problem at all.
Okay. They can book through the website?
Yep. Through WhatsApp. I mean, after, they coordinate with you. And it's,
we have our clinic manager who's handling all this kind of consultation. So
no, it's something we did a lot during COVID when people were into lockdown. Actually, it pushed us to do that, and so now we're on the on the right path with that. We function.
It's convenient. It's convenient for people who wants to travel.
Yeah, exactly. Well, that's good. Thank you for offering that service, and thank you so much for your time. Any last questions, requests before we sign off? Nope. All right, perfect. I want to thank you both. This was so informative. I had a few aha moments as well that I'm excited to pass on and share with others as well. And it's always a pleasure listening to you both, being so passionate about what you do. Thank you for always being leaders in the field and really making an effort to educate your audience. You know, you have a beautiful practice here in Dubai, but you're also very active on social media, really trying to educate the public. So if you're not following, Dr. David Roze, you can reach what's your account again? Dr. Roze BioHealth?
BioHealth,
Dr. Roze BioHealth. So they're sharing amazing information also online. So really, thank you very much for your time tonight. Really appreciate it. And if there are any other questions, from members who were not able to.
Anytime, honestly, reach out anytime.
Yeah.
Thank you,
I'll
Bernadette. Thank
make
you
sure
so
that
much
they
as
get in
well
touch with you.
for having this forum and having this community. I mean, that's an amazing job that you're doing with the Be Better program, and I'm sure it will be more and more successful with all the
Thank
people
you.
that want to learn more about functional medicine.
No, it's so
Yes,
important.
absolutely. Great. Thank you so much for being here. And I want to wish you all a good night.
Yeah, good night to all. Rest well.
Good day to the rest.
Thank you so much. Bye-bye.
Yeah, true. Bye.
Bye.